couple of things. So I'm just going to repeat this. So welcome everyone. My name is Patty Clark. I'm the National Executive Director with Active Aging Canada. Thanks for being here this afternoon. Just a couple of housekeeping duties here. So one is, I understand that the booklet, the Be Wise booklet, which I'm speaking about today, is in the office at the center, and you are welcome to please go in and pick one up. In the presentation today, in the next 45 minutes, I really just cover highlights of each of the little sections in the booklet. So I'm just touching the surface of the information that's in the booklet. So if you're interested at all in it, I'd encourage you to go in and pick up a booklet from the staff at the center. That would be wonderful. And also, as part of this project, we would ask that you fill out, it's a 1-minute e-survey that I will send to the staff at the end of the presentation, and it literally is 1 minute. It's 7 questions just to tick off, and we just want to know if you found this useful and informative. And we add these all in together. It's completely anonymous. We just add them all together, and when we submit a report to Health Canada, it helps us to say, well, you know, we did this, they like this, they didn't like that. So I'll send the e-survey out, and then it'll get sent out from the center. And if you could take just literally 1 minute and complete it, that would be wonderful. The other thing I'm going to do, as much as I know it's nice to see someone when they're speaking, I live in the rural area of Mulmer, Ontario, which is about an hour north of the Toronto airport. And I am on rural internet, and I swear, depending on how the wind blows, my internet comes and goes. So we have found, in order to keep it a little bit stronger so I don't get too unstable, I will turn the video off while I'm doing the presentation, because you only really want to be watching the screen and you can just hear my voice. You don't need to see my face. And then when I'm finished, I'll put it back on, and we should have 5 or 10 minutes for questions at the end if you've got any questions. And I will, my corollary to the question and answer is that I actually only have the knowledge that's in this booklet. I don't know really anything more than what's in this booklet. And I'm not a doctor, so I can't do any kind of prescribing or anything like that. But I'm happy to answer some general questions and perhaps refer you to somebody else if need be. So we will have a few minutes at the end. If you've got any questions, then we'll take them at that time. So having said that, I'm going to stop my video so you won't see me anymore, and we'll start the presentation. Okay. And I have asked that if I do become unstable, I don't know that my internet is kicking out on me. I ask that someone please interrupt me and say, Patty, we can't hear you anymore or something, and I can go back a slide or two to wherever it's become unstable. But hopefully things will work well today. So welcome all. I wanted to share just one slide with you and let you know about Active Aging Canada, our organization. We are a national charity. We've been incorporated since 1999, so we've been around for over 20 years. And we strive to promote a society where all adult and older adult Canadians are leading active lifestyles that contribute to their overall well-being. And we do that by supporting lifelong, healthy, active aging through participation, education, research, and promotion. And as an example, specifically in this project we've been working on, the participation with older adults is that we had several older adults involved in our focus groups across the country, and we did online surveys, which I will be going into detail in a minute. With our education, we've been doing these seminars since September, and we will continue to do them into the new year. With our research, we actually don't, it sounds like someone is not muted. I'm wondering if everybody can just mute their phones there or their computers, because I'm hearing a fair bit of noise in the background that other people are hearing too. Thanks so much. With our research, we actually don't conduct the research. We do have a research director on the organization, but we actually go and gather the research that others have done, and then we bring it together and we go through a synthesis process to determine what does this mean for older adults in general. And then through promotion, we've done all kinds of promotion for this booklet through doing webinars, and we've done ads, and it's on our website, and a variety of different ways to promote the content. So every time we take on a project, this is how we try and support the project through these 4 processes. And I do certainly want to acknowledge the financial support from Health Canada, the Substance Use and Addiction Program. We received funding for 26 months to create this document and to disseminate it across the country. An overview about the booklet. The first comment here is that it's written specifically for Canadian older adults. So that's not to say that it's not relevant to people who live in the States or for someone who's 45 or 50 years old, but it is specifically for Canadians because we talk about Canadian law, and what the law is in the States relative to cannabis is quite different than what it is here in Canada. So it's specifically about Canadian law, and it is written for older adults because although the content, the facts and information are the same, we also talk about what the effects of cannabis as we age and what does that mean to us as an older adult. So it is specifically for an older adult, but the content is still relevant for anybody to read. We did an extensive literature review. We ended up actually going a worldwide literature review, and that was because cannabis has not been legal in Canada for that many years, so there has not been a lot of grant money put into the product because it hasn't been legal. And so we had to go around the world to find what the literature says from a scientific perspective with respect to how does cannabis affect us as we age. We also did an environmental scan because we certainly did not want to reinvent the wheel. If there's something out there that dealt with cannabis in older adults, then we might have just disseminated that as opposed to creating our own. We did not find anything even close to what was it we wanted to do. So we knew there was one other document out there, but just a 1-pager, and it talked about guidelines, nothing really having to the depth of what we wanted to do. So there definitely was a gap that we were trying to fill with this document. And I talked about our participation with older adults. We did 6 focus groups and online surveys. The first 3 focus groups, they were all supposed to be in person, but they all went virtual because the pandemic hit just as we started getting going on the project. Someone's mic is still not muted, and we're getting a lot of background noise. Could everybody just make sure that your mics are muted, please? Just so everybody doesn't get that background noise. Thank you so much. So we did three focus groups right at the outset, and we were asking them, what did older adults want to know about cannabis, and how did you want to get the information? And then we also did the same thing with online surveys. Ask same questions. What do you want to know? What are the issues? What are your concerns, and how do you want to get it? So based on that information, we went out and gathered the literature, put it together into a draft format, and we did 3 more focus groups after that with about 24 of the pages, and we now have about 55 pages in the booklet. But so with part of the book that we went to 3 more focus groups of older adults across the country and said, okay, so this is what we're putting together. What do you think about the content, the look, the feel, the type, the color, everything? And we also sent it out to an online survey. So in total, we had over 600 responses from older adults across Canada, giving us directions to what they want to know, how they wanted it to look, how do they want to be informed about it, and what kind of products would you like to have with this content. So we're creating this for older adults, so we need to ask them what is it they want to know and how do they want to get the information. We also, in all of our projects, we put together an expert review panel. We bring in people from across the country who have expertise in a variety of different areas relating to our project, to make sure that they provide us the direction to make sure we are getting the right content and moving in the right direction with the project. And I'll review that in just a minute, who those people were. And all of this was really to be able to answer questions for older adults and provide links and resources to where you can find more information. So our booklet is by no means the encyclopedia on cannabis. It's information that was available at the time that we were able to put into the booklet, but there's always more information out there, and certainly medical health care practitioners will have a lot more information. I spoke about the expert review panel. I just wanted you to get a sense as to who the people were that were on the committee. So Jane is the executive director with the Active Living Alliance for Canadians with a Disability. Rob is from the RCMP. Catherine's a professor at McMaster University in social sciences. Wendy is a professor at Yorkville University on the East Coast. She's also an IT whiz, and she's an older adult education specialist. Desi is a member of NICHE, which is the National Institute for Cannabis Health and Education. Greg works with the Canadian Public Health. Lisa is our research director, and she's the one that goes out and gets the research and does the environmental scans. And Marilyn is a clinical geriatric addiction specialist at Baycrest. So you can see quite a variety of people from across the country with bringing in different areas of expertise. You can't see me, I'm just having a quick drink here. One moment, please. And this is the book that we're going to talk about. I also wanted to just provide the overview that the booklet, it does not condone, condemn, or prescribe. It simply provides information to inform and educate older adults on cannabis use based on the most current evidence as of January 2021. We started doing this in 2020, and we had to stop gathering more research because we had to get the document to print. And our research director, Dr. Stathakostas, was finding every month there was a little more research coming out. Nothing significantly different, but we had to stop and actually start to get the document into print. And based on the feedback from the focus groups and our own knowledge of how older adults want to receive information, we have got several different resources, the same content, but it's available in a variety of different formats. So we have our Be Wise booklet, and it is available in 16 languages. And as of the fall, we had distributed over 50,000 copies. And we're just currently waiting for additional funding so that we can print another 50,000. And we expect to get that in next month. And our project will be done early January 2022. We put it in an EPUB format and in Braille. And that is what we try and do with all of our projects, is reduce as many barriers as possible for older adults. So one of them certainly is cost. So the booklet is free. It's mailed out free of charge. You can phone in and order it. You can access it through our internet, through our website, and you can order it. Also, though, people who have got who've got sight impairments and sight challenges are not able to read the book. So we put it into Braille in French and English, and it's also in an e-publication format so they can listen to the document, listen to the content anyways. We also did podcasts of the content. And we did this based on the feedback from the focus group that we offered in the Northwest Territories. And at that particular focus group, there were several Indigenous older adults there. And we were talking about languages, and up in that area, I believe there are probably 6 or 7 different dialects that they speak up there, and recognizing that we cannot possibly translate into those dialects. What one of the women suggested was that a lot of Indigenous people certainly understand English. They may be able to read some of it, but they may not be able to read it really well to understand all of the content in the booklet. And she said that they do a lot of their learning through podcasts, that they can just listen to English and they understand the content. So another way then to reduce the barriers for people who have got challenges with reading English or French or the 16 languages was to put it in podcasts. So we've done 21 of the podcasts, and we launched one a week for 21 weeks. They're now all posted on our YouTube site. And they're about anywhere from 3 to 4 to 5 minutes long, very short. And you can certainly watch them. It was also suggested about doing short little 2-minute videos of little snippets of information from the content, just to encourage people to either order the booklet or to watch all the podcasts or to listen to it, whatever. So we've been launching videos once a week, and I think we're up to about video number 6, and we'll continue to do that for several weeks. We also are making these virtual presentations as we are today. Excuse me. Initially, the plan was to be attending seniors fairs and making presentations to the participants at seniors fairs, but that obviously is not happening. So these virtual presentations are working quite well. Excuse me, one moment. And also, the booklet is available you can order it, or you can download it right directly off our website, or you can call in and order it from a 1-800 number. So lots of ways in which people can get the content for them to read. So what's inside a booklet? The tabs here are the different sections of the booklet. We've got older Canadians and cannabis use. That's sort of statistical information. We have facts about cannabis, cannabis and the law, therapeutic benefits, side effects and risks, aging in cannabis, talking to your doctor, and dosing in your health conditions. And all of these topics really are based on the content from what people had said in our focus groups as to what they'd like to learn about. So each one of these tabs has a different section in the booklet. So what I'd like to do is just as I said, a very high level summary of the different sections to get so that you can get a sense as to the content in the different sections. And then of course, there's much more information in the booklet for you to read about. So this information comes from Statistics Canada. And we're talking about the use of cannabis by adults 65 years and older is increasing faster than any other age group. So in 2019, which was the last time we had statistics, 6.6% of older adults reported using cannabis, and that is up from 1% in 2012. And the reasons for the increase is because of changing attitudes toward cannabis, and there's also an increased curiosity about its health benefits. And we're going to talk about that throughout the presentation. And with respect to older Canadians and the use of cannabis, so out of the 6.6% of Canadians, older Canadians, said they use cannabis, 24.4% of them said that they used it for recreational purposes. 23.6% indicated that they used it for both recreational and medicinal purposes, but 52% of them said that they're using it for medicinal purposes. So this increased curiosity about their health benefits and how it can maybe help older adults is becoming more and more evident. And so a lot of people are now looking to the cannabis to see if it may be able to help them. And older Canadians said that they use cannabis as an alternative therapy. And if for the older adults using it for medicinal cannabis, and they're using it for pain, for anxiety and depression, for sleep problems, as an alternative to a prescription drug, and to achieve a better quality of life. So I'm going, in the 45 minutes, I'm going to go through a lot of tidbits and facts about cannabis. But if there's one thing that you take away that you remember, or these two initials, this would be one thing that would make your life so much simpler to understand when people are speaking about cannabis, that there are, right now, that there are two active chemicals in the cannabis plant. One is THC and the other is CBD. So THC stands for delta-9 tetrahydrocannabinol, and CBD stands for cannabidiol. We don't need to remember the names, and I don't even say them again after this one slide. We just need to remember THC and CBD, and I'll be referring to those throughout the presentation so that you'll understand the difference between the two components and why it's really important to understand that there's different chemicals. And talking about, as I mentioned earlier, how the research is changing, and speaking with the woman Desi from the niche group, the cannabis education group, she said the research is now showing that there's another active chemical that they're able to use and extract from the plants. I'm not going into that, and it doesn't really matter this presentation, but it just once again reinforces that the research is ever changing in this topic. We're going to talk about THC and CBD. So there's a variety of different ways in which you're able to acquire cannabis. It can be from a fresh plant. It can be dried leaves. It can be in an oil format. You can actually get the plants and grow them in your home. You can actually get the seeds and grow them. You can put cannabis in edible foods like brownies and chocolates and muffins and whatever else. You can get it as an extract, and you can get it as a topical cream. So there's a variety of different ways depending on the needs of the individual and the purpose of it as to what format works for them. So this is why it's so important to remember about the THC and the CBD, because they have different therapeutic uses. The THC has a psychoactive component. So when people were smoking marijuana in the 60s and 70s, they were smoking it to get that psychoactive effect. So they would call it the high. Not everybody thinks that it's a high, so we don't want to use that expression, but it has a psychoactive effect. Whereas CBD has no psychoactive effect at all. So if people are using cannabis for medicinal purposes, the predominant chemical in the prescription is the CBD. So it's a non-psychoactive component. But both of them are used in therapeutic uses. And cannabis with THC is used for anti-nausea symptoms, to relieve spasms, to relieve pain, and to stimulate appetite. CBD, the non-psychoactive, is used to reduce pain caused by inflammation, such as osteoarthritis in your knees or your shoulders, control or preventing seizures, to control anxiety, and to relieve symptoms of psychosis. So there's different ways in which people can use cannabis. So the first is recreational cannabis. And recreational cannabis with the THC in it produces the feelings of euphoria or relaxation. So the recreational cannabis, it means that a person is using cannabis for enjoyment rather than for medical reasons. And while medical and recreational cannabis can come from the same plant sources, the products will focus on different chemical properties depending on the desired result of what you're looking for. Self-therapeutic cannabis. So this is where people are obtaining cannabis without a prescription, which is absolutely legal, through a licensed provider. And some people choose to use cannabis in a way to self-medicate for reasons such as to reduce anxiety or for pain management. Now, as you see, as we get through this presentation, from our perspective and the research we have done, we do not recommend that older adults look at self-therapeutic cannabis. And the reason for that is because of the potential interactions with other medications that older adults might be taking. If they're on either prescriptions or over-the-counter medications, there is a potential that they may interact with each other. And I'll get to that later on into the presentation. But that's the reason we don't recommend it. And then there's also using it medical cannabis. And the medical cannabis is prescribed by a doctor to treat specific health conditions and symptoms. The prescription is filled by a licensed producer, and the prescription can be for either natural cannabis products in the form of THC and CBD or CBD, and it can also be in a synthetic cannabis drug form, which is only available by a prescription. So in addition to the natural cannabis products, there's also a pharmaceutical preparation, and they are available through a drugstore. And these are either created from the cannabis plant or they're recreated in a laboratory. They have defined potencies and dosing information, and the prescription cannabinoids that mimic THC, they have been approved by Health Canada for use in Canada. And these particular brands are called Marinol, Sesamet, and Sativex. The names aren't that important to you. I'm just sharing them with you, and they're in the booklet, so for your information. And they're being used right now in the treatment of multiple sclerosis spasticity and pain due to cancer. So there is a lot of research out there saying that there are medical purposes for cannabis, and a lot of the other ones, as I get through the presentation, that there's some limited research in the area. With respect to cannabis and the law, this is where I was saying that this specifically about Canadian law. So in Canada, you are allowed to possess up to 30 grams of cannabis. And when I was putting this together, I really thought I have no idea how much 30 grams would be. So I had to go Google it. And when I Googled it, and you can't see my hands now. If you put your hands together sort of in a cup formation, which I'm doing, and you can't see me, about the size of a small green melon, a cantaloupe or a green melon, not a watermelon, but a small melon. That's about 30 grams. So what you hold in your hands. You can also purchase it online from licensed producers. You can also purchase it in licensed retail stores. You are allowed to grow up to 4 cannabis plants in your home. And you're also allowed legally to make cannabis products, so food and drinks in your home. Where you obtain the cannabis does depend on the province, but in Ontario, we do have licensed private retail stores. So they're popping up all over the place and across the province. There's also government operated stores, and I believe that's in different provinces. You can get it online or by telephone, and you can get it by mail for medical use. So you can, when you go to your doctor and get your prescription, they can actually mail it to you every month or however frequently it is. When it comes to traveling with cannabis, our best recommendation is basically don't do it. If you're traveling into the States, you're not allowed to cross the border with it. A lot of the states do not, it is not legal in a lot of the states. So then you're bringing an illegal drug into the country or into the state, and that's not allowed, and that could get you in hot water. And all the rules are different as soon as you cross the border, and you're not allowed to take it across the border. So if you're in control of where you're going with respect to the fact that perhaps you're driving in Canada and you're going from province to province or city to city, you're fine to have it in your car. If you are not in control of your traveling, and if you're flying, and even if you're flying within Canada, and then all of a sudden the weather turns bad and the pilot says, oh, I'm sorry, we're going to have to reroute and go into Wisconsin, the States, because I can't fly into Winnipeg, all of a sudden you've crossed the border and you've got an illegal substance with you, and that's once again going to get into trouble. So the easiest rule of thumb is they just don't travel with it unless you're in a car and you're in control of where you're going and you're not going into the States or any other country for that matter. So talking about therapeutic benefits, this is a very simple explanation, but we wanted everybody to understand how the two different types of the chemicals, the CBD and the THC, how they respond in our bodies. So very simply, we have in our bodies, it's called an endocannabinoid system. And the cannabinoids, which come from the cannabis plant, interact with the endocannabinoid system. So that makes sense. That the stuff from the cannabis plants interact with one of the systems in our body. And we have two different types of receptors. We have the CB1 receptors, which are all the red spots in our body, and see how a lot of them are up in the brain and they come down our nervous system, down our back here. The CB1 receptors are responsible for the psychoactive effects of the THC. And you can see that they're found in the brain, the central nervous system, and some of our organs. And the role of these different receptors are in memory and mood and sleep, motor control, cognition, appetite, and pain levels. So it makes sense when people are preparing a prescription for an individual, depending on what the medical conditions are, it depends as to whether you need to have some THC in the product, because it's a THC that works with those receptors in your body. The CB2 receptors, which are the blue dots, and you can see them spread out. A lot of them, there's a few up in the brain, but a lot of them come further down and they're in your organs and that. They do not have a psychoactive effect. And those receptors are found in the peripheral organs, especially the cells of the immune system, muscle and bone tissue, and they have a role in reducing inflammation. So as we were chatting about inflammation earlier and in osteoarthritis, they're finding some positive effects from the creams that you can put on, that you can rub on your knee or rub on your shoulder, your elbow if you've got osteoarthritis, because it helps to reduce the inflammation. And that's what arthritis is. It's an inflammation of your joint. So if you can reduce the inflammation, that allows for more movement and that reduces the pain, and life is good. So there's a difference between the CB1s and the CB2 receptors. And this is the difference why THC is psychoactive effect on some parts of your body and CBD does not, because it reacts with different receptors in your body. So a very general overview, but just to give you an understanding of how it's working in your system. With respect to medical conditions, once again, I have to say, as I have said frequently here, we have limited scientific evidence to support some of the therapeutic claims. Health Canada does allow the use of cannabis for any medical condition, as long as it's prescribed by a doctor. But the cannabis has not gone through the regulatory processes required to be approved as a drug. So that means you can't claim it on your OHIP. So the government's not going to cover it under the drug plan. But if you have a prescription from the doctor, you can claim it on your taxes. So it's considered an allowable expense, but it has not gone through the drug process to be part of the drugs that are paid for through the government. But if you want to do it, that's when you have to have the doctor's prescription. If you just want to use it and not claim it, then you can just go to the store and buy it yourself if you wish. And as I mentioned before, there are a few synthetic cannabinoid products that have been approved clinically for specific conditions. And the Sesamet and Sativex, that's just what these are, what a couple of the names of them are, just for your information. So we have had benefits that have been reported from older adults. And we say that these are anecdotal because it's just what people have told us or have put into documents. It has not gone through a rigid scientific process. And that's not to say that these benefits are not true, but because it hasn't gone through a scientific process, as an example, people are saying they feel they've had a better quality of life with it. It has helped them with sleep. It's helped with pain. And it allows them to stop using other prescription drugs, which is really important as we age. And sometimes we can start to get a collection of different prescriptions in our drawer. And this has allowed them to stop using so many of them. So as I said, it's not to say that this is not true, but as an example, if someone has said it helps them with sleep, well, we don't know if it's the cannabis that's helped them with sleep, or perhaps have they stopped having coffee or Coke with caffeine in it at nighttime, or perhaps are they exercising more, or have they changed their diet, or are they getting up earlier too? So we don't know for sure that it's just the cannabis that's doing it, but they have reported that it has helped them with these are the benefits people have reported. And there certainly is truth in this, but as we said, it's anecdotal, so we can't say absolutely for sure this is the reason why. There are 3 conditions that do benefit from medical cannabis. And this has been proven in the scientific literature. So chronic, unrelieved, severe pain for people in palliative care, nausea and vomiting caused by chemotherapy, and muscle spasms due to multiple sclerosis or spinal cord injury. The literature is very strong in these areas that there are benefits of cannabis for these conditions. There's been positive results for nerve pain as it relates to multiple sclerosis, people with diabetes, pain related to HIV, post-surgical or post-traumatic pain, and fibromyalgia. So they have found that there are a lot of treatments that it's very beneficial for. Looking at conditions that are being treated with medical cannabis. So I just said there's certain kinds of pain that they're using cannabis for, and they're finding to be very effective. With respect to arthritis, I mentioned earlier about they have found that to reduce the inflammation of the joints and the nerve pain caused some osteoarthritis. There's a lot of promising research there, but it's still quite new and it's limited, but there's lots more going on, but they're showing promising practices for arthritis. With respect to palliative care, right now, a lot of the focus is on cancer pain. So to keep people comfortable in in palliative care. With sleep and insomnia, the research is limited, but there has been some positive results. So that does seem to be going the right direction, that it does seem to help people with sleep and insomnia. Lack of appetite. So you may have heard when people were perhaps smoking marijuana in the 60s and 70s, and they might say, well, they get the munchies, and they very well may have gotten the munchies. But the research does not show that it actually causes that feeling of getting the munchies and being hungry. But it does, right now, the research does show that the THC can increase appetite in people with HIV and AIDS and cancer patients. So it can help them to increase their appetite to eat a little bit more. Glaucoma is kind of interesting because there's been a lot of discussions about glaucoma and cannabis, because cannabis can reduce the swelling in the eye, but it does not reduce the eye pressure. And the issue is that for this to happen, the dose required is much too high to be considered safe. So the experts in the field is the Canadian Ophthalmological Society. They right now do not support the use of cannabis as a treatment for glaucoma. Now, certainly in the future, they might find a way to use it, but right now, the research as of January, they are not supporting the use of cannabis for glaucoma. Parkinson's disease, there's been a lot of promising research in animals. It's used as an anti-inflammatory properties of the CBD, and it may reduce some of the symptoms. We were talking, in one of the slides earlier, we talked about how it was being used for agitation, aggression, and muscle spasms. And so Parkinson's has that muscle spasticity. That's one of the issues. And so there's a lot of promising research that it may help to calm that condition in Parkinson's disease. With respect to dementia, there's some success in easing the agitation and aggression associated with dementia. So there's a calming influence, so people aren't as agitated, and that certainly makes them be easier and certainly more comfortable. And anxiety and depression. So there's some mixed evidence here. And because it can heighten anxiety in people, it's not recommended to treat depression. So right now, it's not being recommended for anxiety and depression. Older adults have commented on short-term side effects, and this has to do primarily with the THC, but they've said that they are short-term. They get dry mouth, drowsiness, dizziness, headaches, cognitive problems such as reduced memory, reduced attention span, slowness to react, poor judgment or problem-solving abilities, impaired coordination and balance, perhaps distorted perceptions, feelings of anxiousness or an increased heart rate. But not everyone has unwanted side effects. And so here, choosing the product with both THC and CBD can help lessen the unwanted effects of the THC. And anyone choosing to use therapeutic cannabis has to take an active role in finding the dose that works for them. So they need to decide if the benefits outweigh the side effects. And it's very individualistic. And it also depends on the kind of the plant that you use. When I was speaking to a colleague and her brother was using it for some health conditions, and the first time he started using it, they weren't getting the desired side effects. And I know that the healthcare practitioner said, well, we're going to change the plant, because depending on the soil that the plant's grown in also affects the chemical composition. So the people really have to understand the type of the plant, the chemicals involved in it, and the balance, and how do we increase one and decrease another so that it works for everybody. So it's quite a juggling act right now. And there are people who should not be using cannabis. So older adults who have mental illness, as I said, because right now the literature still is saying it does not support people with depression or mental illness. And if there's a family history or mental health condition such as depression, anxiety, or psychosis, those people should not be using cannabis right now. Older adults with cardiovascular disease or unstable blood pressure should not smoke cannabis, and because any type of smoking will worsen a heart problem, whether it's smoking cannabis or smoking cigarettes, or any smoking is not good. And older adults with impaired balance, because it increases the loss of balance, and this has to do with the THC. So if an older adult already has impaired balance, having cannabis with THC in it, which is a psychoactive component, could also make them unsteady, and they may be at a higher risk of falling. So these types of people should not be using cannabis. When we start to look at risks with aging, there's not, as I mentioned, there's not a lot of research in that area yet, because it's only been legalized for a short period of time. But because the THC, which is a psychoactive component, is thought to connect with receptors in the body that affect coordination, balance, and depth perception, so that they know that. So there are definitely some risks involved with aging. So there's certainly an increased risk of falls. So as I mentioned about the THC, it can affect your coordination and your balance. You could become drowsy and dizzy. Right now, there's very limited research on the topic. A small percentage of older cannabis users have reported feeling uneasy on their feet when they have THC in the prescription that they're taking. So there is an increased risk. There's also no evidence for safe levels of driving and cannabis use with the THC in it. Driving after cannabis consumption is illegal, just like it's illegal to drink and drive. You cannot smoke, you can't use cannabis with the THC in it and drive in Canada. Some of the effects of cannabis use, such as drowsiness, can last up to 24 hours, well after other effects may have faded off. This becomes a very individualistic criteria here. In one of my other sessions, one of the questions at the end, one of the women said, well, if we used it to help as a sleeping aid, to help us sleep at night, does that mean that 24 hours later, we're going to take another cannabis plant, another cannabis pill? And that means we can never drive because I can't drive for 24 hours. And so now this is going above my level of knowledge. I said, well, my thought is, and this is just my Patty's thought. I thought, well, if you're using it to help sleep, it would be a CBD. It would not have the THC in it because the THC is what stimulates and provides that psychoactive effect. But then another woman came on the question and answer and said, well, she has some THC in her sleeping aid product, but it's predominantly CBD, but there is some THC in it. And I said, well, we've now gone above my pay grade of knowledge of what I know about it. So I really don't know. But after the presentation, I did speak with some of the people from the expert review panel, and it is very individualistic as to how you respond to it. So you have to be aware of yourself as to how long it stays in your system. Their comment was that usually in 6 to 8 hours, because it's such a small amount of THC in the product, so by the next morning, it typically has left your system. But for some people, depending on the individual, depending on the size of them, how well they process the chemicals in their body, it could potentially be up to 24 hours. So it becomes very individualistic from that perspective. How much you consume and whether it's been smoked or eaten, all of these things have an effect on how long it stays in your body. There's also a risk of addiction. Excuse me one moment. For older adults who have other substance use disorders, such as alcohol addiction, they really should avoid cannabis use. It may increase the other addictions they may have. Oops, sorry, I'm gonna go back. The last one is with respect to withdrawal. So the brain adapts to the presence of cannabinoids in our systems, and that may lead to a dependence. So if a person suddenly stops using it, they may go through withdrawal. And the research on withdrawal in older adults is still very, very limited. But the research we have does show that older adults may have withdrawal symptoms similar to those of younger adults. But this is often for those of prolonged users, and this is with the THC in the product. So you may experience some withdrawal symptoms. And once again, everybody is different. Everybody reacts differently, and depending on how you're using it, it's very, very, very different for each person. There's also a risk about overconsumption, and one of the big reasons for this is because the potency of the products is much stronger today than what it was in the 80s. So the THC, which is a psychoactive component, has increased from 3% to 15%. So if somebody in their 20s was smoking it in the 70s, they were only getting a THC concentration of 3%. So now if you add 50 years to that, and if you're 70 and you start to smoke cannabis, well, the potency is at 15%. So it's significantly different than what it was in the 80s and the 70s. So that's a big issue. Another one, determining the safe dose of the product may also be challenging for individuals, depending on how you absorb it, how you use it. And all of the different ways in which you can use it are in the booklet, and it talks about how long it takes it to be absorbed, how long it stays in your system. So all that information is in the booklet. And then also the other risk of overconsumption is with using alcohol and cannabis with the THC in it, using it at the same time. So that's like having alcohol, which has an effect on your system, and then using cannabis, which has a psychoactive effect. So it's like a double whammy in your system. So it's likely to result in a greater impairment than either using one alone. So that can also become a risk. So in a sort of an overall summary from our aging and cannabis. So as I've said, limited research. We do know that it works for some chronic diseases and some health concerns. There's still a lot of limited research, but there's more happening every day. We do know that our bodies change with age. That's definite. And it may produce effects in older people that are different from younger users. So for example, cannabis affects parts of the brain that are involved in learning, memory, and decision-making. And these same parts of the brain will change with age, and they do not work as well. And we can all probably attest to that. So it's possible that the effects of cannabis could further impair brain function in older adults. So this is what they're just looking at now. So they know our bodies change, and they know that we respond differently than we would have when we were 20. So we know that there's other issues to consider. And then there's the issue of dosage. So medical professionals, they really have to think about the dosage. Because of the age-related changes in our liver and our kidney functioning, our body fat, and our digestive system. And all of these changes impact how effectively a medication is and what that dosage should be. So age-related body changes also affect how quickly the body eliminates the cannabis. And it may take longer for older people than it does for younger people. So the dosage is very individualistic, and it certainly changes as we age. So I was mentioning earlier about how cannabis can interfere with other prescriptions and over-the-counter medications. And here are some examples of it. So cannabinoid levels can be increased by other medications. So whether it be an over-the-counter or a prescription, if you take that and put in some cannabis with it, it might increase the THC or the CBD effect because of whatever that prescription is. In the second example, cannabis can affect the level of other drugs in the body, and it can have an additive effect. So if this is a prescription and you add cannabis, it could actually affect this, and it could increase the purpose of whatever this drug or over-the-counter product is and make it stronger, which may or may not be a good thing. Using cannabis by smoking can increase the clearance of other drugs. So if you're taking let's say you're taking a prescription for high blood pressure, and then you smoke cannabis, that actually could clear the medicinal effects of the prescription out of your system, and you would no longer have that preventative measure for maintaining your blood pressure. So it could actually clear it out of your system. And then the fourth area has to do with sedative medications. And so increasingly you're finding that anesthesiologists are asking patients about their cannabis use before operations because it may affect the amount of sedation required. So they don't really know what's going to happen, but they know that there can be an effect if you're taking a sedative effect and also using cannabis at the same time. So our best recommendation is to start low and to go slow, because we're saying it's so individualistic on each person that by starting with a very low dose and monitoring for a few weeks and seeing if the desired effect is being achieved or not, and then very slowly change it, increase it to a different compound, a different chemical compound, and observe that for a while. So one of the things we did, we put in the back of the book, it's just a chart that you can record what the dosage is, and then you record how you're feeling. So when you go back to your healthcare practitioner, you can say, well, we're doing this, and for the past 2 weeks, I've experienced this, or I've not experienced this, or I felt nothing, or I've done this, or done it, whatever it is. you've got some documentation, and then that healthcare practitioner can say, okay, this is not what we're looking for. We need to modify it somehow. So it's really important that you start low and go very slowly when you're trying to find out what's going to work for you, because what works for me might not work for you. So if you're starting to use cannabis or starting again in later life, this is sort of the summary of things that we've been talking about. You need to be aware of the amount of THC that is in the cannabis product or the strain that you plan on using. You need to start at the very lowest possible level and slowly increase the dose until the desired effect is achieved. You need to avoid the illegal synthetic cannabis, and those are K2 and Spice are the names of those. So there is legal synthetic cannabis, but there's also illegal, and you want to avoid the illegal because there's a much greater risk of bad side effects, excuse me, among older adult users. Because of the high potency, pardon me, because of the high potency of the illegal synthetic. So you want to avoid the illegal stuff. You do not want to combine cannabis with any other recreational drugs, including alcohol, which we've chatted about. If you have an addiction to alcohol or any other drug, you're at a much more risk for cannabis addiction with the THC in it. You want to make sure you're using cannabis in a safe environment. Because the THC, that psychoactive component, is thought to connect with receptors in the body that affect coordination and balance, we want to make sure that when we're trying it, and as we get older, falls can become a greater concern. So we want to make sure if we've got a product with THC in it, we're doing it in a safe environment. So because we don't know what the effect is going to be on us. So we want to make sure we're safe when we're trying it. And then there's no driving after consuming cannabis with THC in it. As I said, it's illegal in Canada. Impairment can last up to 24 hours, but it's very individualistic. And the last part is about talking with your doctor. So it must be tailored for each person. And when you're talking to the doctor, what needs to be considered is the symptoms that need to be treated, because as you can see, there's a difference between where THC affects the body and where CBD affects the body. The severity of the symptoms, and there's other health problems, and if there's any possible unwanted side effects. And when talking to your doctor, one of the things that people said in our focus groups, that there's that stigma about talking to it with your doctor. I don't know what questions to ask. I don't know how to pose that topic. So we've put questions in here that now once you've read the book, you've got a better understanding of the different types of the chemicals in the cannabis. And then you can ask informed and educated questions to your doctor. But it's really important we stress to consult a healthcare professional. And my thought on this is that you may go to your family doctor and he may not be current enough in the area to really be able to advise you. And because if he prescribes something for you, he is liable for whatever he is prescribing. So he has to have a good understanding as to how it's going to work. And right now, a lot of general practitioners, they don't have that. And it's simply because there's not a lot of information out there yet. So to me, the best option is that if your healthcare practitioner is not able to speak to you about it, that they find someone who is. And there's certainly lots of clinics around where they can help you. So if they're not able to consult with you on it, then find someone who is. But certainly from our perspective, we don't encourage that older adults try and do the self-medication just because of all the risks that go along with it. Your doctor needs to know about it because they're the ones who might be monitoring any prescriptions that you're on, and they need to make sure that there's no unwanted side effects from mixing the different compounds together. With that, I will say thank you. And we've got about 5 minutes. If people have got some questions, I'll just, oops. I'm stopped sharing my screen. Okay, I'm coming back on and I'm back there. Welcome to all of you. Nice to see you again. There's a question here from Beth. Do the cannabis providers require you to sign a legal disclaimer? I don't know, Beth. I quite honestly, I haven't been, Rob is saying no. So Rob is saying no, and Rob knows more than I do on that, so.
I've
No,
actually
no.
done a lot of research on this, and there's two websites out there. One's called WikiLeaf,
Yeah.
and the other's called Leafly. And
Mhm.
they have a wealth of information about different strains, what you're looking for. And they
Right.
actually have reviews on people that have used the products. So they give you a breakdown of what the effects are, you know, what to look out for, and perhaps that particular strain doesn't suit you. You know, you just
Right.
don't use it.
Right.
And if you have any questions, present it to your family doctor and say, this is what I found. And like you said, they don't have all the information yet. You know, they may be able to take it a little further.
Yeah, and you're right, Rob. I mean, that there's so many options out there, combinations and permutations of how the different strains of it and where it comes from and the soil that it's grown and all that, that it's for someone who is not studying it all the time, it's very hard to try and keep up on that. So it's great to go in with some knowledge, but you need to speak to someone who really, that's what their career is all about. They know about, so they can advise you on that. I saw another question. Let me just scroll up here. My camera's on. Oh, 30 grams is approximately 2 grams over an ounce. Okay, there we go. If it's via prescription, it is also tax deductible to see your receipts. Yes, that's what I was saying. So it is, it's tax deductible, but it's not paid for through a prescription plan. Now, what I do understand is that some extended healthcare plans are now adding that in some of their coverages, but it's very specific, so you'd have to check. For local Hamilton area, Dr. Ira Price is a cannabis activist and owner of Synergy in Burlington for medical cannabis. Well, there you go. That's recommended by Robin Z. If using cannabis for sleep, it needs to be indica folks who are prone to anxiety or panic disorders, then either use hybrid, definitely not sativa, as it can trigger episodes. So once again, see, it's very individual and different for people. So everybody's got different kind of different side effects in that. Terpenes, yes. I don't know what about, love terpenes. So I have to leave, would like to copy the book. Okay, you can get the terpenes.
I actually put that message in there. It goes back to the two websites that I was suggesting there.
Okay.
They'll tell you what the active terpene is, and these terpenes are supposed to be associated with different qualities of the cannabis.
Yes, yes, yes. And we'd actually do talk about terpenes in the book. So there's a little bit in there. So if you read it, you'll get an understanding of what it's all about. I was picking out 45 minutes worth of little tidbits, but yes, it's in there too. So thank you very much. Does cannabis work the same as without it? I'm not sure, Sarah, what that means. So these are direct messages back and forth, so they're not necessarily for me. There's oh, please fill out the survey. Okay. Well, I have 2:59 on my clock. If people I've answered what I can answer, but there seems to be a wealth of knowledge out there. So please do pick up a booklet in the at the center, because there's lots of information in there. And obviously, as Rob was saying, there's some great websites. And those two, I do know of those. And you have to be careful, of course, when you're going on websites, who's speaking the truth and who's speaking Patty's thoughts as opposed to what's real. But anyways, yeah, those two, I have heard of those before. So thank you all for coming. Nice to see you, Rob, and Karen, nice to see you. Hope this was helpful. I will send the survey out, and if you could take, oh, there we go. If you could take just a minute, we would appreciate that. It just, as I said, it all comes together in an overall report. If you found it useful, informative, if there's other things, you know, by all means, let us know. So thank you very much for your time. Nice to see you.
Nice to see you. Bye-bye. Thank you,
Okay.
Patricia.
You're welcome then. Thanks, everybody.
Thank
Bye.
you.
Bye-bye.